Excellent. Okay. Well, again, thank you so much for inviting us to the Fall Lecture Series today. So today we present our work, Caring in Distance, Telehealth Training for Future Speech Language Pathologists. This project has been carried out in collaboration with professors Yvonne Redman, Sarah Wegley, and Dr. Bridget Sweet at School of Music as well. And we would like to thank the Office of Provost and Vice Chancellor for Academic Affairs and the Center of Innovation in Teaching and Learning for providing us the grant that made this project possible. So telehealth or telepractice is a rapidly growing area of healthcare, which has greatly improved patient access to care, clinical outcomes, and patient satisfaction. The current pandemic accentuated the importance of telehealth with the restriction of in-person encounter in the medical offices. And last spring, the pandemic also forced our speech language pathology and audiology clinics to quickly move their practice from in-person to telepractice so that our students can continue their professional training and our clients can continue receiving their care. One of the challenges there was that the students needed to get into the telepractice without any formal training. So speech language pathologists have been using telehealth for more than 20 years, and there continues to be a strong interest in developing telepractice. As in many other areas of medicine, speech language pathologists treat patients in remote areas, and some of these patients are limited in their mobility, which severely restricts their access to care. Another population that benefit from telepractice is children. Parents are not necessarily able to secure time to drive 45 minutes to their children's speech therapy, or home health services may not be necessarily available to some areas of their residence. So given the interest and the necessity, many telehealth training programs have been developed for speech language pathologists, but these are exclusively catered to licensed clinicians. There are only a couple training programs available for graduate students in speech language pathology, and I believe actually there's only one graduate level certificate program in telepractice in speech language pathology today. As we all are learning, delivering our service via teleconferencing tool like this poses unique challenges. I believe we are all learning that as teachers. There are always technical issues, but also not being in the same room with our communication partners limit us from using nonverbal communication strategies. So for clinicians, it affects their ability to convey a sense of empathy to their clients. And this is a problem. Research has shown that such communication is crucial for forming a strong therapeutic alliance with their patients, which ultimately affects the patient's adherence to the prescribed treatment and treatment outcomes. So student clinicians needed to learn a fundamental technical and practical skills to deliver their service in a telehealth environment. And that was the motivation of our project. So we decided to incorporate standardized patient training, which allows students to practice fundamental skills such as patient interview and counseling with actors. And this is a safe, low-risk environment, which should be very good for developing their self-efficacy. So this collaboration became possible through the collaboration with the School of Music. So we set up three aims for this project, and one is to provide the training to speech language pathology students, and the second was to provide opportunities for students in the music and theater programs to learn about individuals with voice disorders and then perform the role of such individuals. And the third aim was to provide any students an opportunity to receive voice evaluation at the free of charge. And I will pass this along to Clarion now.
Thank you so much, Dr. Ishikawa, and thank you very much also for commandeering our slides for us. I don't have anything as exciting to offer as an in utero stomach growl, but you might hear my cat snoring under my feet, so I apologize if you hear Pythagoras underneath my toes. So I want to share with you a little bit about the steps that have been involved with the telepractice experience that we've been able to provide for our students. And so this is part of the SHS 511, Assessment and Management of Voice Disorders course. And so as we designed this for a module for our students, we began with a traditional didactic lecture about the technology telepractice, the technology that's required in implementing telepractice for our students, in particular, having to modify it for remote service. As many of you are aware, when we're looking at assessing and monitoring the voice, we need to make sure that we have high quality, high fidelity tools in order to manage speech signals. And so training the students to ensure that they're still able to do that despite not being in the same physical location as their patients. We also discussed legal and regulatory issues because since we're still providing a healthcare service, we're still bound by the rules of HIPAA and other privacy rules and regulations as well. And also as far as telehealth etiquette, so making sure that we're able to provide a safe and secure environment for the client, and also to create that rapport that may be a little bit more challenging when we're looking at a remote evaluation or assessment. And we'll also talk about how some of that didactic training is what we're going to use as part of our outcome measurements as far as determining the success of this particular project. After the initial didactic practice, the students were given the opportunity to do peer practice. So they were able to incorporate all of the elements that we would use in a typical voice assessment and practice with each other. And so the risk there was relatively small. And this included both developing a case history, which I think our students might share with us is kind of difficult to do remotely. We developed the case history as well as some questionnaires that are very commonly used in a voice assessment, such as the Voice Handicap Index and the Vocal Fatigue Index. And we also collected acoustic data as well as the perceptual data that we use for a voice assessment. This really gave the students an opportunity to practice getting the flow of a voice assessment and also probably get some of those jitters out. I should mention that as Dr. Ishikawa explained to us, telepractice has historically been somewhat rare in graduate education. COVID has changed this significantly for us. And telepractice is considered an advanced clinical skill by our certifying body, the American Speech, Language, and Hearing Association. And so this is one of the other reasons why we thought it was important to do some formalized training for our students regarding this. Our standardized practice patients were students of acting or students of voice, and they were formally trained in acting as if they had a voice disorder, and they did a remarkably good job. And the students were given the opportunity to assess the standardized patients. This gave students a tremendous amount of freedom because legally we are required to supervise 100% of the time with any sort of telepractice client. And so there's a clinician right there the entire time. And with a standardized patient practice, our certifying body allows the student to be a little bit more independent and not be there the entire time, even though it is via telepractice. And then the exciting part, after building up the scaffolding, I love how Dr. Braun used Bloom's taxonomy in exploring this. If we continue to build on Bloom's taxonomy here, after that, we recruited students that are enrolled in vocal health classes to serve as our patients. And so our students are currently in the phase where they have the opportunity to assess these students using the voice assessment battery that Dr. Ishikawa and I developed. And so as a result, after the students create and craft and complete their assessment, the patients are using a couple of outcome measurement tools to measure the effectiveness of the student's bedside manner. And so they're using something called the CARE measure, which is a tool that's typically used amongst physicians. To my knowledge, and Dr. Ishikawa can answer this for us, it has very rarely been used in communication sciences and disorders. In fact, there's very little research to look at the empathetic skills of speech language pathologists and audiologists. And the the real patients as well as the standardized patients are also rating our students based on their telepractice etiquette skills. And so we'll be able to have some data for you within the near future about how our students did. And now I'd like to pass it along to, if you could advance the slides for us, Dr. Ishikawa. We have the great pleasure of having 3 of our students who are enrolled in SHS 511 today to talk a little bit about their experience today. So we'll have Brianna Legner go first. She is also an alumna of our undergraduate program, as is Hannah, and we warmly will welcome Megan as well. So Brianna, if you'd like to go first.
Yeah, of course. So this training, I feel, really surrounded our learning and our understanding of how to conduct an evaluation more independently. As Dr. Ishikawa mentioned before, telehealth is becoming a critical service, especially during this COVID craziness. And I feel that the training really helped us to do the proper ways of conducting a telehealth session. In my case, I had a client who was acoustically typical, and then our standardized patient scenario, we had a speaker who was a little bit more on the dysphonic side. So it was so nice to see the differences in the acoustic measurements and being able to analyze those where we might be able to do that in the future. I feel I learned the material better, in my opinion. Definitely more confident instructing a voice evaluation because of the multiple opportunities we had.
Brianna, thank you very much. And I also love how you, I didn't even think about the benefits that you had by comparing the quote unquote within typical limits acoustic data versus the acoustic data that showed impairment. Thank you very much. Hannah, I'm going to pass it over to you now, if I may.
Hi. Yes, I would just echo everything Brianna said. So I think it was wonderful that we kind of were able to go step by step in being able to conduct these assessments and having them grow progressively more difficult. But having that practice was really amazing. So I'll just share. For me, my standardized patient session went really smoothly. But then when I got to my real client, I had a technological glitch and I was in the session early, but I got kicked out. And I had to restart my computer twice, and so I ended up being a few minutes late to the session. And so, you know, with telehealth, like things like that are going to happen. So it's really important to be flexible in that regard. And so for me, being able to practice with a standardized patient, I think that helped a lot with keeping my cool, coming back into the session a few minutes late, and just being aware of, okay, now I know what I have to do. I know because I had everything ready before, so I kind of had to pull everything last minute. But I think it really helped in keeping me, like helping me stay composed and very professional with the client.
And I can say just by my observation of Hannah, and please keep in mind, Brianna, Hannah, and Megan are in their very first clinical semester. So this is a tall order, giving them this level of independence with a telepractice experience. And you are completely unflappable. And so I'm very proud of you there. And last but not least, Megan, please.
So I have many of the same comments that Brianna and Hannah do, but I'd say for me, the thing that was most valuable about this project was being able to incorporate feedback from our supervisors, but also feedback from the clients, and be able to apply that to the real clients that I saw in the clinic, because I've also completed a couple assessments, teletherapy assessments of voice patients this semester in the clinic as well. So being able to take the feedback from class and incorporate it has really made me a stronger clinician.
And I promise that we did not give them a script. This is their own independent thought regarding their experience. So thank you to all of our students, Dr. Ishikawa, to all of you today, as well as the Center for Innovation in Teaching and Learning and the Provost Office. And I'll pass it back to Dr. Hadley.
Thank you both for that wonderful presentation. So just like with the last speakers, we are now open for any questions. You can also direct those to the students if you'd like. There are, really appreciate you joining us today.